Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith, and today I'm here with Kathryn Shewfelt. Kathryn, I'm going to have to take a deep breath in order to describe what your role is in this incident management situation. So for the COVID-19 incident management team, you are, I'm going to have to read this, the emergency preparedness specialist, you are the advanced planning lead with the planning section, and you're also the support services lead within the operations branch. I'm almost afraid to ask, but what is the scope of all of your responsibilities?
It's a bit overwhelming at times, but we've got lots of great teams working on all of this work, so it's not too bad. So as the emergency planning specialist, I work really closely with Nicole Moffat, who's our emergency preparedness lead and really our expert in emergency planning. It's really about helping the incident management team set the structure and sort of determine where things fall within our incident management structure. As the support services lead, I'm within the operations branch, so implementing any projects that have to do with our support services department. So a bit of my normal hat every day with our day-to-day operations. So laundry portering, housekeeping, nutrition food services, medical device reprocessing, security. Any of those projects that need to be implemented that have come over from planning, I'll lead those with my management team. And then if there's any projects that don't sort of fall into any of the clinical service or support services, they come through the support services branch as well, and we'll implement those as we move forward. The advanced planning lead, I'm overseeing the personal protective equipment branch, the research branch, and the education branch. That was sort of a later addition as we were partway through the process, so lots of great work had already been done, so it sort of just took over a bit of a leadership role there. The personal protective equipment group has done an amazing amount of work setting the practices and processes for PPE within the facility. Our research group reviews all the clinical trial requests that are coming in, takes a look at any other studies that we want to be doing, and then is also really a spot for us to drop research questions. So if incident management team has any questions that they have that need to be researched, we pass those through the research branch. And then our education branch is responsible for making sure our frontline staff are clear on the policies and procedures, any changes in practice that have happened, and really making sure that they're reassured and know what needs to be happening on a day-to-day basis. So lots of work, but lots of amazing team members that are there to help with that work.
How many people are you working with? It sounds like there's a number of teams behind you.
For sure. So Nicole and I are really taking the lead for emergency planning, so sort of two of us with those hats. But in support services, there's 4 managers that are reporting to me. We'd also pulled in some extra help with some of those support extra projects that we had, and then there's a lead for each of the branches in planning. So there's a lead for the PPE, for research, and for education, and they're taking away and got groups working with them on all of those projects as well. So lots of amazing work happening.
That's an extraordinary amount of work. How are you doing it all? What does a typical day look like?
A typical day is pretty busy. It's been a little crazy the last couple of months, and it's sort of evolved as the pandemic's gone on. So really we start our day with the incident management team meeting that you're at as well, and it really helps us set our priorities for the day and focus for what we're going to be looking at over the next planning cycle. It's then quickly followed by a planning meeting where again we're talking about what the planning priorities are, and the operations meeting. So at those 2 meetings we're really updating where we are on our action items, getting any projects approved, and getting assigned any new tasks. The mid part of my day is really either reviewing plans that other people have created or writing them if they maybe don't have time to get them, or if it's something that falls within my role. Spending my time touching base with those team leads, checking in with my management group with my sort of normal hat on, just to make sure if they need any updates or if there's any support that I can provide to them. We then have a second planning meeting during the day just to clarify what our priorities are for the next planning cycle, which we're still on the 24-hour planning cycle, to make sure we know what we're doing over the next day. And then we sort of end the day with that last incident management team meeting, and those are usually sort of the longer ones where we're reviewing the projects, reviewing any decisions that we need to make, sort of debating where we want to go and having those discussions. So it's a pretty fulsome day, lots of meetings and lots of touching base with the teams that are reporting to me.
A lot of activity tracking too, it sounds like. You really sort of have to have it all straight in your
Yeah.
mind, what's going on in all of these areas.
Absolutely, and I think we've got really good documentation about all the tasks that we're doing, but I did have someone create for me my own so I could kind of separate out my tasks in each of those areas and sort of color-coded them as to what we're working on. So yeah, keeping track of those tasks is definitely a big part of the job.
You're a very well-organized person. I'm
Thank you.
sure that's
Yeah.
serving you very well right now. So we've been at this for several weeks now, over 8 weeks.
Yep.
What would you say have been some of the most significant changes that you've seen over the course of that time, given your role?
Yeah, I think it's been interesting to watch this process evolve. So I actually started in a different role. When this all first launched, I was in the logistics branch as the transportation lead, and then as operations grew, moved into operations, and then, a couple weeks in, I can't even remember when, had the planning piece added. So I think it's really just stepping outside of our original roles and thinking about looking at the organization through different lenses and sort of adapting on the fly to the changing roles and circumstances that have sort of come at us. So just lots of day-to-day changes.
Meeting the needs where they are?
Yeah, exactly. Yeah,
Wow, that's
absolutely.
great. You actually are quite privileged to be working with so many different people in so many different areas.
Absolutely. Yeah.
I would love that opportunity.
Yeah.
That's great. So normally, you mentioned this already, you're the Director of Environmental Services. Can you still do that and be that in this environment with all those other things happening? How are you managing it all?
Yeah, some days better than others. The workload has definitely been overwhelming. We've had to take some of our bigger projects and put them on hold as we go into this pandemic. So it's really that time to work with my managers and work with their teams on those projects is not there anymore. But the day-to-day work has really continued under the leadership of our frontline managers and the frontline staff. So all of that day-to-day work in those departments is still getting done, and they're being led by the managers in those areas. And I am a bit lucky in this, in that one of my hats does touch with my original management group. So as the support services lead, those are all my managers that I work with on a day-to-day basis. So I've got that extra bit of contact that I can make with them as well throughout the day.
But it's great to have qualified people to rely on. Everyone seems to be stepping up to the plate.
Absolutely.
That's wonderful.
Yeah.
What would you say are some of your biggest takeaways from this experience? What learnings will you apply going forward?
Yeah, it was neat to kind of reflect on that question as I was looking at what we were going to talk about. So I think the biggest thing for me is how effective we can be when we're focused. So this has afforded us a unique opportunity to really focus on one issue or one way of looking at healthcare. And I think the amount of work that we've accomplished over the past 8 weeks is a bit of a testament to that ability to focus. And it's not to say that we've only done a couple of things. It's just we've accomplished a lot of projects focusing us in the same direction. And I think that ability to focus has allowed us to accomplish amazing things.
I think so too, and there's an extraordinary amount of work. I don't imagine that most people truly appreciate, they're just not aware of work that goes into planning, even if those plans aren't implemented, right? It's the same amount of work, and that's really a lot of the work that your teams are doing.
Absolutely. So, it's making sure that we're ready to go if things escalate. And even the smaller projects, still, there's a lot of planning and operational impact to all of those. So lots of work there. And I think the other thing that has really stuck for me is our ability to use the incident management system and what the impact of that has been on a larger scale. We've used the structure on smaller incidents that have happened within the facility, but we've never used it to this scale. And I think we've really been able to see the power of the structure and what we can accomplish as we're able to expand that structure within the organization.
It's a powerful learning experience.
Yeah, absolutely.
Well, what are you most proud of in terms of our hospital's overall response?
Yeah. Hands down, the answer is the people, right? From the frontline staff that have stepped up, we've had staff willingly working in higher risk areas. We've had staff volunteer to be redeployed to other areas that need help. So even within the support services, we've had a number of staff redeployed to other areas where there was higher workload. They've helped us think about how to do work differently and really helped their managers sort of work through all of that. Our frontline leaders have worked tirelessly to change the way that we do business and support their staff. Most of them are having daily huddles, touching base with their staff on a regular basis, and coming up with new procedures and ways of doing business. And our leadership team has gone above and beyond. Everyone came willingly to the table, volunteered. They were flexible in what they were doing. They stepped out of their comfort zones and applied their skills to areas that were outside of their day-to-day jobs, and were still able to support the managers that reported to them. So I just think the way that everyone has stepped forward and worked as a team and brought their passion and their expertise to the discussions has been amazing. Yeah.
I hope everyone is proud of the work
Yeah.
that everyone who is part of the hospital team is accomplishing.
Yeah,
right now.
absolutely, yeah.
If you have a message to leave with the community at this time, what is that?
I think, first of all, a thank you. The community's been really supportive of the hospital. Lots of donations coming in, from food for the staff that are working in all departments, including support services, to the donations of personal protective equipment. I think it's really amazing how people have stepped up. And I think my other message is really just keep up the hard work. It's a challenging time. We have families that are at home as well, and it's hard for people to be home for going on 8 weeks now, but it really has made a difference in helping to flatten the curve. So if people can just stick with the public health guidelines and keep washing their hands and stay home when they can, I think that's really going to help us as a hospital going forward.
Solid advice.
Yep.
Kathryn, thank you very much for the entire wardrobe of hats that you're wearing right now. You're doing a fantastic job.
Thank you.
Thank you so much for joining us. We'll see you again soon.